Good afternoon, everyone. Welcome to Planning Your Professional Development Journey, Part 2. As you come in, if you would let us know in the chat your name, maybe your location, and we're also talking about how long have you been working in the substance misuse prevention field. We got started just a little early to let folks in from the waiting room. So you have time to maybe have a glass of water, and also let us know in the chat who's here in the room with us today. Welcome, welcome, welcome. Welcome, everyone. As you come in, if you could tell us in the chat your name, your location, and how long you have been working in substance misuse prevention. Today's session is the second in a series on planning your professional development journey. And so we were interested in knowing how long folks have been in the field so far. It's always been a mix, and we just like to know. It helps us when we think about where each of you is in your journey, and how we can talk to your needs more. So we'll get going in just a few minutes. Come on in. Welcome to everyone. Oh my goodness, so we have Liz, who is brand new, 2 months. Welcome, welcome, welcome. 3 months, Katerina, welcome. Who else? Virginia, 2 months. Oh, this is wonderful. Angie, a year. This is excellent. I hope I say this correctly. Nakima, 3 years. That's wonderful. So folks are kind of new. This is excellent. It's so exciting because we have some really fabulous people doing our presentation today, people who've been in the field for a long time and have wonderful experience and lessons learned, and who are still just as enthusiastic about all of it as they were when they began. So come on in. We're going to get going in just a couple of moments. We have a year, 2 months. So when you come in, folks, people are letting us know in the chat about how long they have been in the substance use prevention arena of work. And we have people from all over. We have people from all over the US, and we have lots of folks who are kind of new to the field. This is wonderful. This is wonderful. And we're going to give it 1 more minute, and then we'll get started on our session. People are still coming in. And all right, I think we're ready, everybody. Let's take another look there. We are. We will get going. So welcome again, everyone. You are here at planning your professional development journey, Part 2. Today's session is with Sandra Del Sesto and Carol Oliver. And if we get back in next. So I'll just do a little tech information. This session is being recorded. So all of you folks, you are being recorded right now. Following the event, we'll share out the recording, and we'll also be sharing out certificates of attendance to those who have attended the session in full. At the end of our session, there'll be a number of different contacts associated with this particular event, and please feel free to contact the facilitators if you have any questions or concerns. I want to acknowledge our funders, SAMHSA, the Substance Abuse and Mental Health Services Administration of the United States Department of Health and Human Services. We come to you free of charge through their funding. And we do have to note that the contents are those of the author, and do not necessarily represent those of SAMHSA. And speaking of funding, As we get at the end of our session, we're going to ask you to be doing a bit of an evaluation for us. It's called the GIPRA, and we ask you, it's only 5 or 6 questions. We really value your feedback and we use it. And additionally, and maybe even sort of more importantly, it shows that we're reaching people, and we are required to do this by our funders to show that we are out here with all of you, giving you the kinds of training in TA that brings value to your work and helps you in your work. And I'm gonna, my name is Claire Neary. I'm the project coordinator for the Northeast and Caribbean Prevention Technology Transfer Center. And I'm just gonna give you a little overview of the PTTC network. Chances are that you have been on a PTTC event at this point, even you folks that are kind of new. The Prevention Technology Transfer Network, there's a center for each HHS region across the country. Our organization is the Northeast and Caribbean Prevention Technology Transfer Center, and we service the communities and the workforce professionals of the state of New York, the state of New Jersey, the United States Virgin Islands, and Puerto Rico. But, you know, obviously we're here for everyone. And the next slide. These are our presenters for today. You're gonna have a wonderful session today. Sandra Del Sesto is as the past former co-chair of the Prevention Committee for the International Certification and Reciprocity Consortium, which is a big part of what we're going to be talking about today, getting that CPS. What does it mean to get a CPS and how does one do it? She has been in the field for over 30 years. She is nationally recognized. She's the co-author of the National SAPS training and so much more. Carol Oliver is also a lead in her field. She also has been in the field of substance use prevention training for over 30 years. She is also a certified prevention specialist. Ivy Jones Turner is also a certified prevention specialist and has been in the field for over 20 years doing training and TA in substance use prevention as an applied evaluator and a whole host of other components of substance use prevention work. So you are in for just a wonderful session today. I want to thank all of our presenters for being here, and I want to thank Shannon Cassidy, who is our behind the scenes tech person, who is wonderful. You all know if you've done these sessions, having that tech person is really key. And lastly, I want to talk about one of the policies and one of the platforms of the Prevention Technology Transfer Network, and that is that language matters. When we create our sessions, we use the lens of words have power and putting people first. And we endeavor to do that when we create our sessions and when we execute our sessions. And before we get going, we're going to do one more slide. I'm just going to review the learning objectives for all of you. So in today's session, we're going to describe the competency needs of the current prevention workforce. We're going to review the benefits and barriers to certification. We will describe the scope of work, the core competencies, and the standards for prevention specialists that are set by the IC and RC subject matter experts in the profession. And we will look at a list of resources to prepare for certification, of which there are quite a few. So thank you all for being here. I want to encourage you all to use the chat. We monitor it always. Please put your questions, your observations, your requests in there as we go through the event. And now I'm going to hand it over to Carol to get us really started.
Excellent. Thank you. Thank you, Claire. So before I start, I just want to welcome everyone who is relatively new to the field. I have to say, one of the best decisions in my life I ever made was getting into the field. And when I got in, I didn't really realize I was getting into an entire field. And I think that's the nature of substance misuse prevention. So one of the most important things about it, and these are some things that we covered at the last session we had. So this is a two-part session. This is the second part. So I'm just going to recap in case you weren't there. So one is that it really requires a well-trained workforce. And we gave the analogy of an elephant. And if we had 5 different pieces holding on to different pieces of the elephant, the tail would feel like a paintbrush and the trunk would feel like a really large pillar. And people would only know that part. But for prevention to work, you really have to understand the whole elephant. You need to understand how it works together. You need to understand how your role fits with other people's role. And it's not like people go to college. You can go to colleges for degrees, but it's not as common. And many people find themselves in the field and then needing to develop professional development as they go. So the nature of it makes it really important, and substance misuse itself. The other thing is that your professional development really should feed your passion, because that's what keeps people in the field. Passion really does. I think going to professional development, especially if in your part where you're like, I'm kind of in a rut, professional development can rekindle that passion. The other thing is there are multiple career paths, and that's something else we talked about. So everything from a prevention specialist, a coalition coordinator, to a school-based health advisor, to a training and technical assistance, to a researcher. All of those are potential career paths. And the other thing is there are lots of resources available through your workplace, through your colleagues, and through professional networks. So you never have to do this alone. And I think that people are more likely to sort of be on a career path and do professional development when they have a supportive group of people around them. So that is what we covered the last time. And I'm going to move to the next slide. So this is what we're going to cover. So first, what does certification have to do with building a career path in prevention? And so why should I choose to actually get certified? There's a certain amount of work in it. And who is responsible? How does this whole certification process work? And what does my state do? And what organization is responsible for it? What are the requirements? What do I need to get certified? And how do I know what those requirements are? And then there's other considerations that you may want to make concerning certification, where you are in your career, what kinds of position you're in, your life-work balance, and we're going to talk about other considerations as well. So next slide. All right, so this is where you come in. So thinking of certification and beginning that process, what I want you to think about is what are all the professions you can think of that require certification? So what are professions that require? And you can put that in the chat and we'll see what people come up with. CADCA requires, yep, CADCA requires certification. LPC, LADC. Okay, I'm not sure. Education requires certification. I'm wondering what LADC is. Sandra, do you know that?
Licensed alcohol drug
Oh,
counselor.
a drug counselor. Excellent. I was actually thinking of a beautician. I was thinking of the person who does your hair. It has to be certified to your state. Therapists, doctors. Yep. RDH, and I'm not sure, but I bet Sandra can figure it out. Barbers, exactly. Excellent.
I don't know what RDH or CRC is.
Registered dental hygienist.
Oh, okay.
I want them to be certified. They're in my mouth. I want them certified. All right, that's great. So clinical positions. Yeah, so certification happens in multiple different kinds of fields. And so the next slide. And at this point, what I'm going to do is put you in the great hands of Sandra Del Sesto, who's going to take you through what does certification have to do with building your career path. And she knows a lot about this.
Okay, well, thank you very much, Carol. I got involved in this whole certification process because I was curious. I was curious as to how the certification process was developed, where it originated, how folks became certified, how the exam was designed, and so I got involved. And so I'll even say it right here: if consider applying for membership on your certification board, your state certification board. It's a great experience, and they're usually always looking for folks who have that passion in the field that Carol described. So let me ask you that question. What does certification have to do with building a career path in prevention? And you feel free to unmute yourself and speak up or put something in the chat box. So what's it got to do with building a career path? So that's what you were talking about last week, those of you who are on the call last week. What does it have to do with that? Any thoughts? Demonstrates some level of expertise. Thank you. Okay, makes for a more rounded education experience. Thanks, Claire. Okay, any other thoughts? Do no harm, Carol said. All right, so public protection, we'll talk about that. Montana, yes, welcome, Angelica. Montana is the newest member of the ICNRC and has just started the certification process for prevention specialists. So Montana was invited and became a member of ICNRC at the last meeting. Secure your job and show that you're qualified. Thanks, Lindsay. State policies and procedures. Yes, 1/3 of our states now require prevention certification for people who are working in jobs that are funded by the federal or state government. Richard said, learn about all the core functions. We're going to talk about that we need to be effective. Great responses, really, that's wonderful. Yeah, and we're going to look at that again. Let's see here. All right. So here are some thoughts. You know, it provides, it advances and professionalizes our field. You know, so all those fields that you mentioned, from those that we consider professional, but you know, plumbers, nail technicians, electricians, you know, anyone who's working in a field where public protection is and health is an issue and a concern. We are definitely requiring those folks to be certified and recertified. As one of you said, it identifies a set of competencies for the profession, like what do we need to know to be a competent professional in that field. It ensures public protection, and that's capitalized because it's so important. So because the bottom line for us is the safety of our participants, and being sure that what we're providing them is the best in knowledge and skills and interventions. And finally, it establishes educational and training institutions. There are about 4 colleges now that offer either a bachelor's or a master's degree in prevention science. And it establishes local and national associations. And so all of your states have a certification board that certifies people in prevention as well as other field. So, and there are certification requirements. So if we make the case that prevention is a profession, certification is part of that. So Claire said Rutgers just began a Master of Arts and a PhD program in prevention science. Oklahoma, I know for sure that you have a program in prevention science at the master's level. Richard said Oasis in New York State has certified prevention professional. Yes, in New York State, the certification board is embedded in the state agency in Oasis. It's one of the few, and may even be the only one where it's embedded in the state agency. But that indicates a real commitment on the part of the state also. Most certification boards are freestanding organizations, 501c3s or 501c6s, nonprofits. Whoops, over to one. Okay. Okay, so there are two basic criteria for when a profession is regulated. So there is a level of risk to the public. And so we do know there are some interventions that have been used in the past and some, unfortunately, in the present that we know are actually harmful. And so by training folks in terms of best practice, we mitigate or reduce the level of risk to the public. And there is a special body of knowledge which requires competency by the prevention professional. So there are absolutely clearly things that we need to do to do our job well. I have to say, when I came into prevention, people came from a variety of arenas. There wasn't a set body of knowledge about which people needed to be competent. But over time, that has clearly been established. Allison said, what would make a master's or PhD program more attractive than an MPH? Or a doctor of DRPH, which encompasses more health knowledge and is broader in scope. It's a matter of, Allison, of choice. I think it's providing people who work specifically in prevention over the years a specific qualification. So it and people are choosing that. It also you talked about a career ladder, I think, in the last session. It also provides a career ladder opportunity for folks. So it's not a matter of either or, it's a matter of preference. So I'm aware of a number of folks who have chosen to get their master's or PhD in prevention science specifically because that's where they want to land, that's where they want to stay. And some programs, as Claire said, emphasize doing research in prevention as well. So it's a matter of choice. So prevention meets the identifiers, both identifiers, as what we define as a profession. And by the way, there is a very strong collaborative group that's working now on incorporating prevention specialist or prevention professional in the job listings, the United States job classifications, which will in fact provide some benefits to those of us in the field, particularly around loans and loan forgiveness, and also provides status for us and distinguishes what we do in prevention as something very specific and unique in the field. So community health workers already, for example, in that list. So we certainly think that we belong there also. So we're working on that. Okay, so let's talk about competency. All right, so it has to be measured and monitored. All right, measured in terms of, can I measure my competence in a certain field? Are there certain things that I can do and do proficiently? And it has to be monitored. So it's not something that occurs at once, but we have to keep attending to the fact. That's why you're here. You're taking this class because you want more information. So we're monitoring people's current knowledge and skills in the field. And that's why we have, like all professions, a recertification process. So we just can't assume that someone is competent. So we have to decide what you need to know and be able to do in order to be competent. So as we've said, other professions measure and monitor competence, and here are other professions, but as I said, we even added more to that list. And so, I mean, I like this visual. So there's knowledge, skills, performance, and that's measured by our supervisor's assessment of what we do, our experience, our level of experience, our leadership in the field, and then our potential to create change in the community, because that's what we're all about, to improve wellness. Okay, so what organization is responsible for prevention certification? I'm also often asked, are there is there more than one organization that certifies people in prevention? And the answer is, in the United States, no. All right, there is only one organization that certifies people in our field, and that's the IC, the International Certification and Reciprocity Consortium, the ICNRC. So how many of you are familiar or have heard the term before? You can either raise your hand or say yes in the chat box. I'm looking, physically, well, a lot of you are off screen. So how many of you are familiar? You could type yes in the chat box. Oh, CADC, Certified Alcohol Drug Counselor. All right, it's one of the certification. No, said Lindsay, I haven't heard of it. Are you going to hear a lot about it today then? Yes, yes, a number of you. Okay, important for you to know. All right, if you plan on making a career in prevention work, as I have, and our hosts, Carol and Ivy and Claire, right? Jennifer hasn't heard of it either. All right, so let me tell you a little bit ICNRC, all right? It was established actually in the Midwest by a couple of states that got together in 1981 and formed the ICNRC and developed standards and then exams, legally defensible, that's a very important word, exams to credential professionals within substance use prevention, treatment, and recovery, and also criminal justice that adheres to the highest standards of quality and integrity. So that's what our role is. And I'll tell you a little bit more on the next slide. So here are the fields where ICNRC offers certification, treatment on two levels, actually three. The ADC, Alcohol and Drug Counselor, the Advanced Alcohol and Drug Counselor and Clinical Supervisor, and then prevention, peer support specialist, and criminal justice. So it represents 72 member boards, including 24 countries. That's what makes us international. 45 states and territories, 4 Native American regions, and all branches of the US military. So right now there are 52 boards that offer the prevention credential. Of those, 4 are international boards and 3 are branches of the military. So we have 40, if I did my math right, 45 states that offer prevention specialist credential, including our newest member, as I said, Montana, and the state of Vermont will be coming on at our next meeting. So describe what constitutes a board, a group of people, right? A certification board typically it comprises certified representatives of the areas where that board offers certification. The person, again, has to be certified. They can apply from anywhere. They're usually interviewed by a nominating committee. And my board, I'm from Rhode Island, by the way. My board probably has about 12 members and an administrator. And that board makes decisions about the qualifications for certification in each of these areas, whether they're going to adopt the minimal standards set by ICNRC or adopt them and add additional requirements. The board also, every board has an ethics committee. So if there is an ethics violation, that committee would be reviewing that charge interviewing and making recommendations to the entire board as to what action should be taken against that person. In my experience, more of the ethics violations are in, unfortunately, on the clinical side and the treatment side, much more rarely in our area of prevention. But it's extremely important, right, that we adhere to ethical standards, and that's why every board has a ethics committee. So they are except in a few places like the state of New York, they have freestanding boards, as I said, and they are apply to be members of ICNRC. If a group wants to add a certification, so for example, Puerto Rico has a board now that has certification in treatment. If there are folks in Puerto Rico that wanted to establish a prevention specialist certification, they would have to go through the existing Puerto Rican board, which is also already a member of ICNRC. In some states, let's see, Kentucky is on here. There's folks from Kentucky. Kentucky has a separate prevention board. If the existing board is not interested in taking on the prevention certification, folks can establish a separate prevention board. So there are several states that do that. Maine, for example, Vermont is coming in as a separate prevention board. Kentucky, I think Kansas is another. So certainly if you have any questions, please put them in the chat box. Did I answer that question, Claire? I hope you did. Hope you said yes. Okay. Okay, thank you. All right. Again, as I mentioned, consider applying to your certification board. Once you get certified, it's an excellent experience. Each board is asked to send at least one delegate to the semi-annual meetings of the ICNRC, where you represent the interests and concerns of your individual boards, and then get the most current information about what's going on in the field. So there is a prevention specialist certification requirements map that has been done by, oh, thank you, Shannon. It's in the chat box, and it's been done by the Prevention Technology Transfer Center National Coordinating Office. So if you go to that link, you can click on your state, and it will list the requirements for certification for your specific state. So it's a great resource, and it's going to be updated on an annual basis. So it's great to have that. Okay, so here are the certifications that ICNRC does offer, and I think I've mentioned this already. So the top three are treatment certifications: alcohol and drug counselor, advanced alcohol and drug counselor, clinical supervisor. And then the prevention specialist certification was established at the ICNRC level in 1994. So we're one of the newer certifications. And then there's a certified criminal justice addictions professional. Some states like Texas, this is a very strong certification, and in other states, not so much. It depends on the certification board itself, which of these credentials it wants to offer. And the newest one is peer recovery specialist, and ICNRC is there are some local certifications for this, but this is the only international certification for those working in peer recovery. Okay, so this is, I think I found this fascinating. This was one of the reasons why I wanted to be involved at the international level because I was curious about how a credential was created. So here goes. All right. Every 5 years or so, a group of subject matter experts come together to develop a job analysis. Okay. Those subject matter experts are a cross-section of people throughout the United States. It's a group of about 15 people. They apply for that subject matter expert position. What we look for is geographic, gender identity, racial, ethnic, age, variation. So it's a cross section, except for the chairs of the committee. All members of the subject matter expert group have to be certified less than 10 years. And they also work in a variety of areas in prevention. So, and then those folks get together. It's usually a 2-day process, and they come up with, they come up with what they believe are the core competencies, what people need to be able to know and to be able to do to be a prevention specialist working in the field 0 to 5 years. So it's not advanced, it's for new folks coming in. And they establish the domains. I'll tell you what a domain is in a minute in that process. So they start off with the domains, which are the broad areas, and then underneath each of those domains, a list of what we call core competencies. So these tasks delineate what a prevention professional does as part of providing competent prevention services. You know, what do you need to know to be able to do this? From that job analysis, the international exam is developed. Okay, and so that another group, or sometimes the same group of subject matter experts, get together and with some instruction by our testing company, ICNRC contracts with a testing company that is competent and experienced in providing exams, competency exams for professions like nurses, physicians, attorneys, physical therapists. So it's their skill set in terms of developing a legally defensible exam. Legally defensible, which means it clearly and definitely, how can I put it, assesses the core competencies needed to do competent work in the field. So the international exam, I'll tell you a little bit more about it in a moment, is developed by that group of subject matter experts. In a few minutes, I'll share with you the location of the candidate guide for ICNRC. Every single exam item has to be developed and based on a specific reference. All those references are listed in the candidate guide. So we develop and identify a set of prevention references and then go into those references and develop multiple choice questions. So every exam item has to have a reference site attached to it. So it's not just something coming out of somebody's head. It actually has a source. Those sources have to be easily accessible to the prevention applicants. So most of them are online. Only one of them is a textbook, and that's the one on ethics. There are other textbooks listed, but they are all already online, where you don't have to purchase them. Okay, so minimum standards are developed. So the standards are around supervision. We'll talk about this in a moment, and around experience, as well as number of course hours you have to take. And then the boards adopt, if you're going to be a member of ICNRC, you must adopt the standards and exams, the minimum standards and the national exam in your own jurisdiction. You can add, as I said, standards, but you cannot go below the minimum standards if you want to be an ICNRC member. So the entire process is driven by prevention specialists, a cross-section, including at least one international member. On our last group, there was a woman from Bermuda, for example, who was part of the group. And because it's an international exam, there are never specific references to US prevention terms. So for example, we talk a lot about the strategic prevention framework, the SPIF. Well, that's something that's specific to the US, but we will talk about strategic planning for prevention, right? Or there won't be any questions about SAMHSA, for example, Substance Abuse and Mental Health Administration, and how it functions, because that's specifically US. So I always think that the international members, keep us honest in terms of cultural relevance, so that it's not specific to the American culture. If you have any questions as I go, feel free to put them in the chat box. So here are the 6 domains. The prevention job analysis was just completed, and it's not even out yet, but the 6 domains have remained the same. So, yes, candidate guide. Thank you, Shannon. So she has the link there. So the first is planning and evaluation, and that really covers, everything you learn about the strategic prevention framework. Okay, prevention, education, and service delivery are those skills and knowledge areas that you need to know to be able to deliver a program in various settings, not just in schools. Communication is all about, working with the media, effective communication with groups. Community organization is, working at the community level, advocating for change, everything that goes along with community organizing. Public policy and environmental change. We do a lot of work in this area already, and we decided that it merited its own domain. The importance of policy, how policy is developed, how environmental change occurs with respect to substance misuse prevention, and professional growth and responsibility. And there is part of professional growth is knowing the basic knowledge around substance misuse. So the terminology, the effects of substance misuse on the brain, all that's there. And then responsibility, that's the ethical piece. So those are the 6 domains, and the questions then are associated with those domains. Okay, so we've been using the term competency. So what do we mean? It's the capability to apply or use a set of knowledge, skills, and abilities to required to successfully perform critical work functions or tasks in a defined work setting. Okay, so in any profession, if I was an electrician, I'd have to know, how electricity works, and the different tools I needed to use to do that work. And then the skills would be, can I actually use those tools and that knowledge to apply to a a particular situation where, electricity is a problem, and then the ability to do that. So in any profession, we're talking about those core competencies. So if we look at that, here it is: knowledge, what a person needs to know about a particular substantive area, the proficiency in performing a task, and then the level of competence in applying the knowledge and skills. So think of your local primary care doctor. He or she or they have to have a certain kind of basic knowledge, and then skills in performing the tasks of a physician. And then we want to know that they have a certain level of competencies. So how often have they done this kind of work, over what period of time, and what success have they had? So it's the state of quality of being adequately or well qualified to perform a task. So that's what we mean by competencies, and it applies specifically to prevention here. Okay. So recently, SAMHSA published a document on prevention core competencies. Okay. So they have a 3-phase plan to get this out to the community. All right. So it's and cultural humility, absolutely, Luz. That's clearly embedded. Oh, thank you for that. I'm going to bring this back actually to the domains themselves here. When we were doing this kind of work, there was a long discussion about whether cultural humility and cultural proficiency, because that's kind of the term we're using now. It's from Georgetown University, versus cultural competency, whether it should be a separate domain. And instead, the thinking was that it's a cross-cutting domain. You can't separate any one of these domains from cultural humility and cultural proficiency. So it's embedded in each one of the domains rather than separated out so that it's sort of like a separate thing that's disconnected from all the other work we have to do. Does that make sense? It was definitely a long discussion. We didn't want it to be lost, but we wanted to make sure that it was embedded in all the areas. All right, so here, see where it says cross-cutting principles? So we have the domains and cross-cutting principles, and health equity and cultural proficiency is definitely a cross-cutting principle. We wanted to be able to develop and identify core competencies and definitions. And then SAMHSA spent more time, their core competencies document, which is one of our references, really goes into greater detail than the ICNRC job analysis about what those competencies are. They are not different from one another, and they align really well with the prevention job analysis. And here's what SAMHSA calls the prevention core competencies domain. The cross-cutting domain includes the interdisciplinary foundations. If you haven't taken a substance abuse prevention skills course or the strategic prevention framework, any courses around that, I strongly recommend that you do. So it's really cross-cutting domain is the basic theories and practice that are fundamental to prevention. So the risk and protective factor theory, for example, the continuum of care, the effects of substance misuse and other problems like child abuse, HIV and AIDS and Hep C, homicides and suicides, violence. All right. Systems thinking, working with various systems in order to do the best work in our, to support wellness in our communities, because that's our overall goal in prevention. Ethical practices is another cross-cutting domain. Basic knowledge All right. And then communication skills. All right. Now, what are the other domains remind you of? Where have you seen those before? Anyone? Until you're new. Okay. Those are the steps in the,
Somebody's has it.
somebody has it?
Yep. Oh, Claire,
Oh,
you
Claire.
had it.
All right, so yes, she's unsure though. She's knows it's thanks, Luz. It's the strategic prevention framework, and that is the planning tool that SAMHSA requires every state and funded organization to use when they're doing the work of prevention. So assessing the needs, the resources, the resource gaps, and the readiness in a community, building the capacity of people in the community to provide prevention services, developing a comprehensive data-driven plan, implementing evidence-based practice, and then evaluating our work. And so all these 5 actually are in the planning and evaluation domain of ICNRC, and the cross-cutting domains are actually embedded in one of the 6 domains, from planning and evaluation to professional responsibility. So there's not a discrepancy between the SAMHSA document and the ICNRC job analysis. I see them as complementary. Okay, so now what do you need to do to be certified? Okay, just here are the domains again, and just so you get a sense of where the priorities are, not that they're not all important. This is how much, what part of the exam, I'm going to get to Claire's question in a second. What part of the exam is dedicated to each one of these domains? Okay, so 30%, almost 1/3 of the exam is based on those 5 steps of the strategic prevention framework, planning and evaluation. 15% of the exam for prevention, education, and service delivery. 15% to community organization of the test items. 15% to professional growth and responsibility. Communication has 13%. Public policy and environmental change has 12%. These may vary slightly with the new exam, but it's going to be pretty much the same. So what do we mean by reciprocity? Okay. Richard wants a copy of the PowerPoint. Okay. Reciprocity means that if I, and this is important in our culture now, if I move from one, and we call them jurisdictions, so it's more than states. If I move from Kentucky to Bermuda, or England, or I'm trying to think of some of the other international boards. That's leaving my head. Say England. That organization, that certification board will accept my certification, and that's what I mean by reciprocal. I don't have to take the exam again, and I don't have to document my coursework. What you may have to do if they have additional requirements beyond the minimum requirements set by ICNRC, you may have to document those additional requirements as well. But your certification can move from one jurisdiction to another. And here are the minimum standards. So you need to have 2,000 hours of prevention work experience. That's the equivalent of 1 full year of employment. Those 2,000 hours can include volunteer time and they don't have to be in 1 year. You just have to document 2,000 years, okay? Education is 120 hours of training and experience. 24 hours must be in alcohol, tobacco, and other drug specific, and 6 hours must be in prevention ethics. So there is a specific prevention ethics course, and that is the course you have to take. It's offered in a variety of settings, but it's a SAMHSA course. And it was established and developed by the Center for the Application of Prevention Technology. You need to have 120 hours of supervision. Every board establishes the criteria for who can be a supervisor. So you would have to go to your board and look up that requirement. And you can have multiple supervisors. So if you want to be a certified prevention specialist, you must pass the prevention specialist exam. You must sign the code of ethics that's specific to prevention. And then you, once you're certified, you have to continue your certification by getting recertified every 2 years and documenting 40 hours of additional training. Any questions on the standards or requirements? Any questions on reciprocity? Okay. Okay, now let's talk about the written exam. So once you submit, if you go on the website for your certification board, all right, and you can find that board's name, address, and contact person. Luz, that's a great question. Let's see, I lost my train of thought. You would go to that location of that board. So go to the ICNRC website, look up your board, and then that will direct you to their website. And the website, in most cases, has online the prevention application, which you would fill out, okay? And you have to document your trainings, okay? So, and Lou said, how do I document my supervision? I work for Coalition. If you are working for an agency that works for Coalition, it would be your, typically your supervisor or your agency director. If you work directly for Coalition, the best thing to do is to have your supervision signed off by the chair of that coalition, who can attest to your ability to work in those 6 domain areas. Again, you would definitely have to go to the website for your certification board, which might be more specific about who that person can be and what their credentials must include. Maybe they have to take prevention courses. Most states don't require that you be certified by a certified prevention specialist, but some do. You could be certified by, supervised by someone else who understands the field. Okay, so, all right, so once you submit your application and your board ascertains that it's complete, you will get information from the testing company about instructions on how to register for the exam. The exams are all computer-based. There's no paper and pencil anymore. They were offered on an on-demand basis year-round at sites that have been established by our testing company. So you might go into a testing site. They're usually at colleges and universities. There may be people in the room that are testing for the nursing exam or a social work exam or another professional exam, and then you would be directed to your particular exam site. So you can choose any site that's closest to your travel. That site could be in another state. You might be on the border, of your state, and it's easier for you to get to another city. That's absolutely fine. So the exam is 150 multiple choice questions with both the 3 or 4 option formats, usually 4. But wait, there's only 125 questions that are scored. All right, I'll tell you why in a moment. You have up to 3 hours to complete the exam. All right, we'll talk about special accommodations in a moment. Immediately after the exam, you will get your preliminary score. So you will know immediately whether or not you passed or failed the exam. The official scores you will get via email later by domain. So if you happen to have not passed the exam, you will know which domain you had the most difficulty with, which would assist you in studying more information, for example, around community organizing. Most states require that you wait 90 days before you take the exam again. Most states do not have a limit on the number of times you can take the exam, but some do. Again, you'd have to check with your individual board. Okay, so you said, wow. Okay, do you have a question? You think it's a lot, a little? Luz, what's the wow about? A lot. It is a lot. It's typical of what's required in most exams. Actually, my son is a physician. His exam is 8 hours long. His recertification exam is 8 hours long, at least, I think. It might be 2 days of 8 hours. So he can actually take it at home. And we're looking into that at ICNRC now, where you don't even have to go to a site, but there would definitely be very stringent requirements around the ethics of the exam. Okay, what is the cost? The cost varies from jurisdiction to jurisdiction. Once again, you'd have to go to your local board to see the cost of the certification. Okay, and the recertification cost is the typical range. Claire, it's usually around I would say $150, $200 for certification, and then less than that for recertification. But it's comparable or less than most certifications. So the ICNRC, along with the testing company's support, provides special accommodations for individuals with disabilities. You have to have that documented by the appropriate physician or, psychologist. Individuals with specific religious obligations in terms of time or anything else. I'm happy to tell you that the candidate guide has recently been translated into Spanish. The candidate guide gives all this information plus the job analysis. It is not posted yet because it includes the job analysis, and that has not yet been completely finalized. But within the next few months, that candidate guide will be up and running in Spanish. In addition, the Latino Prevention Technology Transfer Center is paying for the translation of the prevention specific exam into Spanish. And so be on the alert. Your PTTC will get this information out as soon as that happens, as well as your local certification board. All right. So accommodations here must be requested in writing with documentation no less than 60 days prior, because those accommodations have to be made and accommodated, whether you're bringing in a sign language interpreter and needing a larger font on the exam, whatever it could be. Okay. Okay. If you don't pass one domain, no, you have to take the whole exam again. If you pass, can you retake that portion? Good question. No, you have to go back in and take, and there were 2 versions of the exam, so you will probably not get the same version. A lot of Latinos are failing certification. Yes, and that's why the Latino PTTC, I'm happy to say I'm privileged to be on their advisory board. And I was one of the folks that was really pushing for this. And the Latino PTTC has, stepped up because one of their goals is to increase the Latino Hispanic workforce in prevention. Okay, any other questions that I missed? Where can you receive preparation training? I think some of the PTTCs have a prep course. I do a prep course. And so you could request that either from your certification board or from your regional PTTC. Okay, Claire's giving you the Latino PTTC website. They also have a fellows program, which is wonderful. I'd get on their mailing list. If you are Latino, the applications for this year's fellowship closed on Friday, but that's an annual thing that they do. Okay, so one of the, how many times can you take the exam? Most states let you take it as often as, multiple times. I know one state says 4 times, but most of them don't have a limit. Again, your local board can determine that. And there is a time frame to wait. I mentioned 90 days, and that's some of your boards do a really good job in helping you with remediation. So they don't see the specific exam, but what percentage of the exam questions in each domain you got correct. What we find is those folks who fail the exam are usually have worked in the field, but only worked in a very narrow area of the field. For example, they've been teaching an evidence-based program in a school for a while, all right, but they don't have any prevention planning experience or community level prevention experience. And so if you are working in a narrower area of prevention like that, it would be to your benefit to join a coalition or a task force in your community so you can understand the full breadth of the prevention field. If you don't understand that, then you're not going to pass the exam. It would just be, like a physician or another healthcare worker only understanding one small part of medicine and not really the breadth of medicine. So Claire made a point here. Some of the PTTCs, such as ours, do sessions in Spanish. So the Latino PTTC definitely does, and have some materials in Spanish. Look at this, is great. Okay, and so there's another link. So you've got a wealth of information here from folks. And Claire, thanks so much for this. By the way, guess I'll put in the chat box, what percentage of people do you think passed the exam? Take a guess. David said 70, 85, 50, 80. Okay, 60. Okay, wonderful. Our pass rate in prevention is somewhere between 70 and 80%. If the pass rate gets below that, they bring together the subject matter experts. We look at the test items, and the ones that are, in fact, we do this on a regular basis. The ones that most people are getting wrong are either eliminated or rewritten, because they're telling us either it's a poor item or it's not testing entry-level knowledge. It might be too sophisticated for an entry-level person. Okay. Conversely, if everyone's getting the item right, that means it's too easy, and those are eliminated as well. So once the exam is revised, it doesn't mean that it stays stagnant for 5 years. There's a periodic assessment by the testing company of the individual items. And so we talked earlier, I mentioned about the 150 items, but only 25 only 125 are scored. The other 25 are sort of pilot testing of new items. So you don't know, though, when you take the exam where those 25 are. They're interspersed throughout the test, but those are the ones that we're trying out that are new and are then written, maybe recently by subject matter experts to see how they fare. About 70 to 80% of people getting them right. If too many people getting them wrong, as I said, they're eliminated, or if they're too easy, or if the way they're written is American or US specific, that would mean that our international applicants were getting them wrong, and that would be another reason for them to be discarded. Okay, so over 1,000 prevention exams have been administered since 2013. I'd say it's probably closer to 1,500 now. Okay, all right. So here's the international pass rate. So the fail rate is 21%. So your odds of passing are pretty good. And right now we have about 3,100 folks internationally that hold the Certified Prevention Specialist credential. Some states will use the letters CPP, Certified Prevention Professional. So that is what I'm explaining to you is what we call the reciprocal exam. The reciprocal certification. Some of your boards have an entry-level certification that may have a different name, but it's usually like an associate, and has no exam, fewer hours of training, experience, maybe like 6 months, and supervision. So it's a ramping up credential. And then you have the Certified Prevention Specialist credential, which is reciprocal. And then some states and jurisdictions have an advanced Certified Prevention Specialist certification. Those are board specific. It is not an international certification, but certainly it's something that people like me are wanting to have because it indicates that I have additional experience, and each board sets its own criteria for the advanced credential if they have one. Does New York have an advanced certification? I don't know. I can forward to Claire a matrix of all the states and whether or not they have an advanced certification and associate certification in addition to the CPS, and you could check your state on that. The CPP is more advanced. There's a CPP and a CPS. I don't. Okay, yeah, I'll send you the matrix. CPP is usually the same as CPS in my experience. Okay, it depends on. Sometimes it's written into the legislation, but ICNRC has asked everybody to adopt, if possible, the letters CPS, but some states are stuck with another acronym. Okay. All right, so here are some resources, all right? And you've got, some of these have already been in the chat box. These are all live links. The domains and the candidate guide. Again, the candidate guide has everything you need to know about certification, including how to take the exam and the job analysis, though the current job analysis is not there. All the other information is the same. There are study materials specifically with the candidate guide. There is a study guide that's free. It's on the, it's on the ICNRC website. It's a 50 item exam, multiple choice exam. It was developed by the state of Rhode Island under the block grant. And then the ICNRC asked Rhode Island, my state, if they could put it on their website. It's a great opportunity, you know, for you to practice, because not only does it have 50 multiple choice items, at the end, it tells you which item is correct and why it is the best response. So think about this when you take the exam. If remember I said this, you're looking for the best response, because there might be another response that's pretty close. And we did send you, or are sending you, tips, exam study guide, exam tips on what you need to do. There is also, for those of you who have test anxiety, particularly with online exams, computer-based exams, there's a practice exam that is $49, which is the lowest price they could charge. And you can access that through this website. Okay. All righty. All right. Are there any questions about certification that I haven't been able to answer yet? It's not required for Montana, but I'd like to have it under me to secure my job. Right. So, and it does, I think, assist in securing your job. So certain states don't require it, but more and more are. Again, I think, you know, I'm a big advocate for this. Okay. All right, so let's talk, just make a few more points. So here's benefits of certification, and I'm going to go through them quickly and then think of if there are any others. So it's a milestone of achievement for identifying professionals who are specialists. So we can call ourselves a specialist. So, and it sets us apart from those who are not certified. And even though your state might not require it, when you're hired, this is definitely a plus for you when you're being compared to another person. It establishes credibility and verifies your competency. It becomes a marketing tool and a career mobility tool for you when seeking employment. It becomes a marketing tool for your agency, where they say, you know, our staff are certified in the field. It offers the benefits of reciprocity. Whoops. It provides, and to me, this is the most important, public protection and a grievance process for those harmed. So that's that ethics committee issue, and establish a cadre of advocates for prevention. Okay, so, and then we have to acknowledge there are barriers. So some states, and I think you should request this if it's not there, some states will allow in your budgets the cost not only of taking courses that have a cost attached to them, but the cost of certification. In my state, for example, that's an allowable expense in our budgets. Another barrier is access to needed courses. Fortunately, now we have courses online, and your state also may have limitations on how many of the required courses, the 120 hours, have to be online, but most states don't anymore. So we always have a challenge identifying appropriate supervisors. The standards may be difficult for some people to meet. Other credentials can be confusing. There's the Certified Health Education Specialist, for example. There's the Masters in Public Health. Those are great credentials also. It depends. Some people have multiple credentials. So, and again, the certification requirement, particularly for, immigrant groups, it requires, I'm trying to remember now. Again, you'd have to look to your state. It might be a high school education or it might be a college education. And the need to document coursework. So for every course you take, whether it's online or face-to-face, you should ask for, and you're getting it for this course, a certificate of attendance. Keep a folder on it. I think Carol talked about this last time. And so that, you just put them in that folder and accumulate them. And then, of course, test anxiety. Okay, so here, quickly, you can find low cost or no cost free trainings online through your state or the PTTC network or other networks. Ask about the availability of project or state funding, which I mentioned. Advocate for a training line item in your state budgets. And then look for a seasoned prevention specialist. Your certification board can give you the names of people who are certified, and they can be and mentor you through this process. Okay. So David said, I've had some difficulty getting the process started here. Is there any tips or point of contact the PTTC might recommend, Claire, to overcome these barriers?
Does it say that Oklahoma?
Yes, he's in Oklahoma. I would connect you to Julie Stevens, who is an instructor at the university there for prevention science, who's very familiar with Oklahoma. And I think she could be a resource for you. And I will put her, I'll have to tell her later today that I did this. She'll be okay with it. I'll put her information in the chat box right now. And
I'll just note that while Sandra does that, we can definitely encourage you, to contact the PTTC as well, just in terms of getting some suggestions, advice, because they're paying close attention to some of the certification things. And I do see Shekinah's question of training in New York downstate. There is training that's available both in person as well as virtually throughout the state of New York. So Shekinah, some of it is to, when you get the slides, you can definitely take a look at some of the locations that we note. The PTTC itself actually offers some trainings that are in person as well as those that are virtual. And then you can always also contact your both your OASIS as well as your PRC, your Prevention Resource Center there in New York State, to find out what trainings are available. Very often your states will offer training through maybe a particular training provider, which will be a great resource to keep track of their website.
So one more thing, and I'm going to pass it over to Ivy. Test anxiety. Test yourself often. Make a daily commitment to study. In the candidate guide, it lists the resources. Those are the places, and only the places, where the test items come from. So if you use those as your study resources, and all of them have to be easily attainable or they're not there, that you will find that really helpful. And then from the sample test, you could identify your weak areas, and then that'll direct you to where you need more study. So here are the resources again. There's also, it's on Amazon. I haven't looked at it yet. I do know Nicole, Prevention Specialist Exam Study Guide, which was authored by Nicole Augustine. The map, that you've gotten the links for these items as well. And there are scholarships from the Pacific Southwest and the Hispanic and Latino PTTC and the National AIAN PTTC. Okay, and you got some state supports here. Here you go, Ivy.
Sure. Thanks so much, Sandra. I think this is such a wealth of resources that's been shared during today's conversation. I will just note that one of the things that you will have available after this session, as well as with the first session, is an action planning guide to support you in developing a plan for how you approach not only your certification, but also your broad professional development in terms of what trainings do you think are going to be helpful, whether it's some of your immediate needs in terms of your work and your job responsibilities, but also those things that you may be thinking of for the long term. And so we just want to encourage you to, think about some of this, use the action plan to support you with mapping out a process that you can come back to again and again in terms of continuing to support your own professional development. And I'm going to bring in Carol to share a little bit more as well.
Okay. All right. I have to admit, I'm really embarrassed, but Carol's not sure what she's supposed to do now.
Oh, Carol, this is where I think one of the things that we had spoken about in the first session that you led was really the link between certification and professional development.
Oh, yes. Okay, great. Yes. So, right. The idea that certification isn't a goal unto itself, right? And you can imagine from the certification process, which is huge, by the time you finish it, it's like, whoo, I'm done with my professional development. But professional development is more than what is just in those domains, right? And if you think back to your passion, or you think back to skills you may want to learn more about, or you think back to the model that talked about novice and expert, and there's different levels that, so for prevention certification, you're going to get a certain level and you're going to have that. But as you go on, you're going to want to get more information, more skills in certain areas, and not to lose sight of it, because it can get really very overwhelming when you're trying to get the certification. So certification is just one piece of a larger sort of professional development plan. And I have to be honest, the further I get in my career, I have certification, but sometimes there's not a fit between what's required of certification, because I already have those things, right? I am aware of those things. And so as far as guiding where I'm going in my career, I have to also have to go to other kind of resources as well. Whether it's my job description or a job description of a job that I want, or a new skill area that I think will really help me. So really, we think certification is great, but we just want to put it in perspective of sort of your larger professional development goals. How'd I do, Ivy, since my brain froze?
That was perfect. And I think one of the things that's so great about what you just said, Carol, is that this is also an opportunity to link with and be mentored by other colleagues within the field, and recognizing that they too can be a key source for encouraging your motivation and inspiration in the field, as well as guidance and support with your professional development. So yes.
And I wanted to say one other thing on that, which I said the last time, but I cannot emphasize it enough, that having the supportive team around you, and a supportive team just means somebody who gets you and knows what to say to you. So I think I gave the example of my older sister who is in computer databases. I know nothing about that, but I have been her partner through her career, trying to map out somebody to, talk to about what's going on, helping her map out what she might want to do in her career. So I definitely suggest having like a team of people, one person, a couple of people who really can help you, especially when it's going great. It's great, but this is a long-term deal. And so when you get a little stuck, who are those people that you can turn to? So
I just wanted to add that ICNRC is setting minimal standards. So you want to go beyond the minimal. And the advanced standards are set by your certification board if they choose to do that. But what Carol said is important. You want to go beyond that. We're just talking about where you want to start in terms of minimal competencies.
We are getting so close to everyone's going to start jumping off. And we wish we had another 15 or 20 minutes to keep taking everyone's questions. That would be ideal. But we know everyone has places to go. So give me a few days and I'm going to be sending out to all of you the slides from the session and the recording. If you could all please take the evaluation, it's very, very helpful, and it's really important to allow us to be able to keep bringing you sessions like this. I want to thank everybody on the session, Sandra and Carol and Ivy and Shannon. This has been just a great training. It's such, you can't find this information anywhere. I looked, I know. So I'm gonna say thank you very much. And thank you all for being here with us. I've seen a lot of, first of all, it's great interaction, great questions, and lots of interaction with everybody. And we'll go through all your questions and the ones that we weren't able to answer in the course of the session. We will do our very best to answer it afterwards and to send those answers along with the slides and the recording. And again, that'll take a few days, but we'll get to you. And that is it. We're going to leave it up for just a moment or two for all of you folks who are taking the survey. And again, I really do appreciate it. Let's see what else. Yeah. Oh, and we'll also send out the wonderful resource on plotting your professional development journey. That will also go out to all of the attendees. So I'll send you, I feel like I'm on like PBS, right? We will send you the slides, your certificate, and slide certificate, and that really nice document, the layout. Thank you. Thanks to everybody. Thank you. You're a great group, and thank you to Team Sandra.
excellent. Thanks.
Thanks so much,
Thank you,
everyone.
everyone.
Bye.
All right, we're going to jump off. Bye, everyone.